The WHO has called for a moratorium on booster shots until at least 10% of people in the global south can be vaccinated. And we would support that call, and we would say that the percentage should even be higher. So we are in a really perilous situation in the world where the figures that the WHO are releasing for the vaccination coverage for Africa is less than 3%. So less than 3% of people in Africa have been fully vaccinated at a time when we're dealing with multiple variants and waves, a devastating increase in the number of cases and also death. And meanwhile, the rich north, which has sufficient supplies, over-ordered, basically cleared the shelves in September 2020 already, got ahead of the curve, undermined COVAX, are now basically ordering booster shots. And that's definitely what the US government has just done.
It will be still inequitable and advancing and deepening existing inequities if you have people who are already having the vaccines, which have been proven to be efficacious. They work, they prevent severe illness, they prevent deaths, to then be the same recipients of a booster dose when you have large populations of people in the world who have yet to receive a single dose. And I think it's at the back of that I would suggest that countries should wait and rather look at ensuring that their own governments support various UN resolutions, but also support very intentionally and very clearly proactive leadership, both in the pharmaceutical industry, as well as in the national and as well as the regional centers in this world, to ensure that we can get to a point where everyone is vaccinated. And look, the issue of vaccine boosters is not foreign to the COVID-19. Many of us in the healthcare professionals, we take boosters for tetanus, we take boosters for hepatitis. So it's not something that is, purely a COVID-19 issue, but because it's happening when so many people around the world have already been left out of the vaccine rollout, it would really deepen existing inequities. And in fact, as we always say, if you protect one region of the world, you are just shooting yourself in the foot, because those gains will be very short-lived. You won't have the success that you wish for. It's only when everyone everywhere who needs this vaccine has access and the shot in the arm that we can then start to talk about boosters for individuals who are already protected.